Test. People confirm that you can't hear them.
Can I keep you on until we see if you can hear us? Okay. Sean's getting ready.
Testing. We think we've got sound now. If somebody wants to tap into the Zoom, can you all hear us in the base?
Yes, I can hear you. Can you hear me?
We hear you. You hear us. I think everything is right in the world again at this moment.
It's in the back.
Oh, good. All right, we're going to start again with our situation update. And if someone, there we go. Yay, sound. Brittany Burton. Thank you, Brittany. All right, sorry, I'm not sure what happened. Something happened. We had to reconnect. So that's the way it goes. We'll just roll with it. We have 472 total cases in Adair County. 22 of those have passed away. 389 have been released, leaving 64 active cases, 60 of those isolated, 4 in the hospital. Adair is one of 7 counties in our district right now that are in the red range of critical spread, which means they're having a 7-day average of 25 cases or more, new cases or more per 100,000. So they're averaging 25 cases per 100,000 per day. Casey has 307 total cases, 16 deaths, 269 have been released, leaving 22 active cases. 21 of those are isolated, 1 is in the hospital. Casey, as of last night, was in the orange critical range of community spread, or orange accelerated, but not in the red critical. So they're one of 3 counties that's not in the red at the moment. Clinton County, 221 total cases, 4 deaths, 171 released, that leaves 46 active. 44 of those are isolated and 2 in the hospital. Clinton's in the red range of community spread. Clinton is at, they're averaging 60 cases per 100,000 right now. And if I'm not mistaken, that may be the most community spread of any county in the state as of last night, as far as I can tell. Now, there may be someone that, we did a quick look at the other counties. We may have overlooked one, but if not the highest, it is one of the highest counties in the state as far as community spread right now. So that's not a place where you want to be. Cumberland County is 132 total cases, 0 deaths, 115 released, 17 active cases, 15 of those isolated, 2 in the hospital. They're in the red critical range of community spread. Greene County, 329 total cases, 9 deaths, 293 have been released, leaving 27 active, 26 of those in the on self or home isolation and 1 in the hospital. Greene is in the red critical range of community spread. McCreary's had 249 cases, 1 death, 227 released, leaving 21 active cases, 20 isolated, 1 in the hospital. They're in the orange range of spread. In Kentucky, we have the red, orange, yellow, and green. So all of our counties are either in the red and orange. Again, 7 are in the red and 3 in the orange. McCreary is one of the ones in the orange. Pulaski, 969 total cases, 12 deaths, 901 released, leaving 56 active cases. 53 of those are isolated, 3 in the hospital. Pulaski's in the orange range of community spread. Russell, 372 total cases, 7 deaths, 312 released, 53 remain active, 51 of those isolated, 2 in the hospital in the red critical range of community spread. Taylor, 446 cases, 7 deaths, 375 have been released, leaving 64 active cases, 63 self or home isolation, 1 in the hospital. Wayne, 255 total cases, 1 death, 207 released cases, leaving 47 active, 44 of those isolated, 3 in the hospital. Wayne is in the red critical range of community spread. For our district, that's 373,752 total cases, 79 deaths, 3,256 released cases, leaving 417 active cases. We are right at our number of active cases. I think our high was this week. Our high case count for active cases happened a day or 2 ago. So we're definitely in the middle of a significant surge right now. Of our 417 active cases, 397 are isolated and 20 are in the hospital. So we've had more cases in the hospital than we do right now, but you have to remember there's been times when we've had significant nursing home outbreaks. Right now, there aren't any significant nursing home outbreaks in our district, so all of this activity that we're talking about is community spread. So as far as our active cases, we have more community spread right now than we've ever had. The other note that I'm supposed to remind everyone is after today, we'll be going to a 2-week media public update instead of a weekly one, and the next one will be on November the 4th. We'll be doing the same time. We're kind of scaling them back because we've had fewer questions week. We got a lot of questions this week, but we got a lot of them off of social media instead of having them submitted. But if we see that there's a lot of demand for information, we can start doing these weekly again. I do remind everyone we do a daily news brief. You can get that from our website. We give the daily case count numbers, new cases, hospitalized cases, deaths, released cases, and so forth. And we have a very comprehensive statistical page that shows everything that's happened since the beginning of the outbreak. And you can even download our master data set from that page if you want to do your own analysis. So that's where we are. Very significant increase in cases right now. What would we attribute that to? I guess a couple of factors. Probably a significant contributor to that is the number of schools that we have in-person instruction. That's a lot of social gathering and a lot of very consistent and repetitive social gathering. And while, a lot of times you don't see the cases show up in the students because they're asymptomatic, if it is spreading in the schools and the kids aren't showing symptoms, they can still take it home, take it to their parents, take it to their grandparents, and they take it to church and they take it to work and so forth. And you see it showing up more in the community than you do in the schools. So that could be a large contributing factor. I suppose the other one would be, this time of year, there's more social gatherings, outdoor festivals, trick-or-treating type things, holiday type things, we have 10 counties and there's different things going on in each county that are getting more people out. And it's a struggle with the social distancing and the masking. So sometimes you see good compliance with that, and sometimes it appears to be hit and miss. So anyway, the final update I will make is if our current mortality rate holds, we'll be we continue to have over 50 new cases a day, which, by the way, I'll circle back around that. Let me give you a today update. As of 10 o'clock today, we have 56 additional cases that will be added today if all of those end up confirmed in our district. 8 in Adair, 3 in Casey, 3 in Clinton, so far 0 in Cumberland today. 3 in Greene, 2 in McCleary, 6 in Pulaski, 5 in Russell, 20 in Taylor. I'm not sure what's caused the big spike in Taylor, but 20 there, 6 Wayne. So
I have an update on that total number, Sean.
yeah, more than 56 is it
Total is now 76.
76.
As of 2 o'clock.
As of 2 o'clock, we're up to 76. I don't have the count by county, but there's 20 more spread out across the 10 counties at this point. So a lot of spread. We may exceed our maximum number of new cases today. We came close to exceeding it last week. The last time we had this large of number of new cases, though, there was 3 simultaneous nursing home clusters. That's not the situation now. Half of our active cases aren't in the nursing home. In fact, nursing homes is a very small amount of what we have. This is community spread. So, Stuart, Dr. Wayman, anything else you want to add? Tracy, anything?
I did want to say, when you mentioned the schools, we know that we have talked to some schools that are having some trouble with, as you said, the students a lot of times may be asymptomatic, but the teachers are of course, a little bit older people, and there's some older teachers, and they are becoming positive cases, and then it's hard to get substitutes. So even by virtue of that, then school may have to be called off just because there's not enough teachers or substitutes.
So you're not going to, unless there's a lot of testing of kids going on, you may not see it in the students. It'll show up with the teachers and the staff and the bus drivers and things like that, because they're the ones that are more likely to be at the age where they're going to show symptoms. I did say I was starting to make a about mortality and hospitalization. If our mortality rate holds and we continue to have 50 plus cases a day, that means that daily we will have, on average, 1 person a day ending up passing away. Now, sometimes it'll be more than 1 in a day, and sometimes we'll go a few days without 1, but we're saying on average it would be 1 person a day. And the hospitalization rate would be about 1 in every 12 and 13 people each day. So at the rate we're going, that's a lot of hospitalizations and a lot of mortality that we're experiencing at this moment in time. I know last week in my news brief, or earlier this week, I made the comment about that level of local mortality and that level of local hospitalizations. I wish we would have more compassion for our fellow man. I don't know about a lot, but there were several people that didn't like that comment and responded that, they feel like there's a lot of other things to take into consideration, like, the damage to the economy and kids having to stay home and those kinds of things. And I don't discount any of that. That's all true. And that's all valid. But I do know also that we're having 1 death and 4 hospitalizations. And without shutting down the economy, if we would all avoid crowds, keep our distance, wear a mask, wash our hands regularly. It doesn't have to be as bad as it is. It just doesn't have to be. And it takes each of us taking that responsibility. And I don't know how to make that happen in our area, but that's where we are. So anything else on as far as introductions?
Remember that death trails are positive cases and these spikes by a few weeks. So we may not see the full impact of these cases as far as death goes, you know, for a couple of weeks down, 2-3 weeks down the road, even up to 4 weeks. One other thing I'd like to add is, you know, we have heard people say, and people still say, that when you look at deaths attributed to the only factor is COVID, that is a smaller number. That's true. But it's the comorbidities. And, you know, most people, when you get, especially a certain age, you know, I think when you start getting in your 40s and 50s, most of us have a comorbidity. And it's that COVID exacerbates these things.
Sort of what I'll say, and Dr. Wayne is more qualified than us to say this, but unless you're dying of a car wreck or a motorcycle crash, almost everyone that dies of accumulation of several things tied together. You know, you've got different issues going on, and just one of them happens to be the thing that pushes it over the edge. That is not uncommon. That's the norm. So the fact that people that are dying with COVID-19 as the primary cause of death, the fact that they have comorbidities is the norm. Is that not right, Dr. Wayne?
Correct.
So, you know, the fact that people will say, well, COVID by itself is not killing people, that's a very narrow way of understanding the way disease works on our bodies. So, let's see, we have Michael Ford, the superintendent there at Russell County, who says, I just want to again thank you for everything you all are doing and being so accessible to me 24/7. Great partnership. Well, thank you, Mr. Ford. I had an opportunity to do an interview with a local radio station there the other day, and I don't know if you heard or not, but I bragged on you for being so proactive, not just in this situation, but in many. I think you're doing a fantastic job there. So we appreciate you too, is what I'm trying to say.
Sean,
So Tracy, you want to take over?
I will, but you all are breaking up some. I'm not sure what's causing that, but just so you all know, there is some breakup there.
Is it more me or more Stuart?
It was both of you all somewhat.
Okay, I'll try to stick closer to the microphone. We'll see if that helps.
Okay.
Just keep letting me know. We've got other options here in case.
And you are still breaking up. Just know that as you're talking right there, but we'll see how we walk through.
Yeah.
And I think a few minutes ago when thank you for the updates, but I think when you shared about Clinton County, I think what maybe you were sharing in response to that is that we hope that none of our counties get to where Clinton is. I know you made the response, we don't want to be there right now, but I think it's looking at our counties overall to not be at that critical stage, I guess, of the spread.
Yeah, and Tracy, you're breaking up too, so it's probably more of an internet connection here at our district than it is anything else, and we may not be able to do anything about that other than disconnecting and reconnecting. So
You're actually good right now, Sean. I don't know if I am, but you are.
Okay, I'll watch the feed and we will see what happens. So if we have a lot of problems, we may have to disconnect and reconnect and let everyone just rejoin the meeting, but we'll see.
Okay, so I'm going to go ahead and start with our first question. I'm hearing of people who have been tested positive who are released from isolation only a few days later. They spend less time in isolation than someone who is in quarantine due to potential exposure. No new testing is required. What criteria is used to determine when someone is released from self-isolation after testing positive?
So this may happen for a couple of reasons. One is that when we get antibody tests results, these become positive approximately 10 to 14 days after onset. Hence, a positive antibody test means the person is over their infection and no longer contagious, and hence does not need to be in isolation. The other scenario is when someone has symptoms but tests many days later. We count 10 days from symptom onset, not test date. People who've been exposed need to be quarantined for 14 days because that is the incubation period for COVID.
And Tracy, on your end, did Dr. Wayman come through okay?
She did, yes.
Okay.
Next
All right,
question.
so hopefully,
Thank you, Dr. Wayman.
hopefully our audio was just something going on with our district internet connection. Maybe somebody was uploading a large file, or who knows. But we'll press on.
Question number 2. Several people have questioned how school districts are opening to in-person when, according to the metric diagram, they are listed in the red, which states that all in-person classes are to be suspended. Just a question I've heard. Can you address this?
Yeah, so the answer is a legal answer. Who has the legal authority to shut a school down? By state law, that authority to shut a school down rests with the school board or the superintendent. And the only way that that would change would be with a change in the law, or by an executive order by the governor, or by a court order, if someone wanted to take them to court and have a judge order to close them. Otherwise, the law puts that responsibility with the school board. So, the public health information that is being shared with the schools is to provide them the information they need to make a thoughtful decision. But the decision really rests on each individual school board. So that's part of being an American. We have rights and we have limited authority as a government. The control is supposed to be at the local level as much as possible, and that's exactly what we have. I mean, I can say also, as far as businesses, no one exactly has the right to shut down a business. So the labor cabinet issues them their permit to operate, so they have some authority to revoke their permit to operate. The health department, we have the authority to regulate public health things like food and sanitation when it comes to business operations. But our COVID authority inside of businesses is hazy. Certainly through the years, we've had situations where we've had to take people to court to close, but it's not a standard thing. And obviously, with the thousands of businesses that we have in our area, we're not going to take thousands of people to court. We're going to try to educate and encourage people to do the right thing when it comes to masking and distancing and following the guidance. So, I know people wish that you could just make people do stuff, but that's not the way the system is designed. So, I don't know. Stuart, you want to add anything to that, or Dr. Wayman?
I mean, over the years, the things that we have been able to shut a business down for, and when I say a business, in particular, I'm talking about a business that has something to do with food. Either they prepare food or they sell food. So either a restaurant or a store. We've had some long-standing, many years, long-standing laws on the book that allowed us to do this for a clear public health measures, something like an imminent health, what we would call imminent health concern. Like if sewage was surfacing in a restaurant, in a kitchen, that's an imminent health hazard. We could shut that facility down and not allow them to make food until that is fixed. Or if they have an infestation of bugs or mice or whatever, we can do that. But with COVID and with masking mandates, that's something totally different than what we're talking about, the authority the health department has to shut someone down for an imminent health hazard.
Most of the public health laws were, started as early as the 1960s and 1970s, and they've been, modified over the years. But laws get written based on the need of the moment, and so the law is much clearer on things with food and sanitation. We've not had a pandemic since 1918. So, the laws for what authority we have for a communicable disease in a business, it's not there. We've not had the problems, since the 1918 was when it happened, and the public health laws were written in the 1960s and 70s and on. I'm just saying that there's not been enough time for those laws to develop, and probably COVID will be over before that all gets worked through. So anyway, a lot of this depends on, the public listening to the, public health information and making good decisions. Unfortunately, we live at a time when social media can really distort the facts and promote a lot of bad information, and we have different people at different political levels at the local, state, and national level that complicate a pretty simple concept of when you have a droplet-borne disease, trying to contain the droplets or space yourself out far enough to where you're not impacted by them. It's not a complicated concept. We've understood this for a long time. Why we've had to make it so complicated, I don't know, but here we are. We're fighting over something that's pretty simple, but that's the world we live in.
Just to finish up on that question, Tracy, the schools, with the authority they have, that rests with them to decide whether to remain in person or to call out, the metrics that are there for them to make decisions, they have not been mandated. So we ask people, when you have a complaint and when you have a question concerning why your school is still in person when they are in the red, according to the metrics, please reach out to the superintendents and the schools and the Board of Education. We can't answer that question for them, and we don't have the authority to close them or to make them abide by what the metrics say. Those has been set out as guidance for them to use. So, if you have questions, by all means, call your school board and your superintendents and ask them the reason.
Thank you.
A couple questions have popped in. Judge Green asked, I know it's probably on your website. May not be on our website, Judge. It may be on the state's COVID-19 website. But his question is, what are the numbers in public gatherings, Thanksgiving, Christmas dinners? As far as personal gatherings for Thanksgiving and Christmas, I'll let Stuart address that as far as personal family gatherings, and maybe also talk about larger events like community events, parades, and things like that. So public gatherings, when we think about Thanksgiving parades or Christmas parades or festivals, and then what would be the recommendation for family gatherings?
So, as we know already, I think Dr. Fauci, who we all know now, and even folks up at the state level, even though we don't have any written guidance out yet concerning the gatherings for the holidays, the only guidance we've had so far is for Halloween. But we 100% know that we have seen this community spread, and one of the places that we've seen it at is these small get-togethers, even, family getting together, and that has caused a spread. So, unfortunately, I think this year the guidance that's going to come out is to very much limit those holiday type get-togethers, and the larger the gathering, of course, the more potential. So it's just like any other gathering. I mean, right now we have the 10-person social gathering clause in effect, and just because there's no magic number. I mean, it could be two people gather together and one person be positive, asymptomatic, not know it, and the other person then become symptomatic and become very ill. So, we want to trust our family and our friends, and we think, well, they wouldn't have it. But, that's not the case. A lot of times we just don't know.
The purpose of having fewer numbers is just so that not so many people are exposed all at the same time. Yeah. A question came in, whose responsibility is it to enforce these mandates in place like food marts where check outlines are right next to the doors and people are unmasked where they enter and exit? Now, sometimes the things that are in place aren't mandates. The things that are in place are guidance. So the difference between a mandate and guidance, when the governor was issuing executive orders, those were more of what you would call mandates or orders or things. Most of that stuff has expired now. Most of what exists now are guidelines or recommendations, and you can't make people do something if they're not legally bound to do it. So I think the mask mandate is still an executive order. I don't know what other executive orders still are in effect.
Part of that, but however, that's much harder to, how are you going to know when somebody's having a small get together at their house? So I think mainly the mask mandates is the big one right now.
Yeah, it's really just an issue where at this point in time, it's really going to come down to each of us as individuals making those kinds of decisions. I had someone ask me the other day about, what about all these big events like at the downtown square event that was held here? Was it over this last weekend? My comment back was if people would quit showing up at these things, they'd quit having them. The fact that people keep going, so it's up to us as individuals. If you're someone who's concerned and you see too many people at a store, don't go in. If you think there's going to be too much gathering for a parade or whatever, don't go. You just take the responsibility to protect yourself as best as you can, because there's a lot of things that there's going to be a lot of things going on where you might not be protected if you don't protect yourself.
And we believe that, once business owners see that people are making this cultural shift to where it's unacceptable that an employee is not wearing masks, it becomes bad for their business. And then when that type of thing starts happening, that will help us more any day than trying to enforce or do masking. It's always, when you get into, I've always said, when you start getting into somebody's pocketbook, that really hurts. And people, they start paying attention then.
Yeah, I know
our own action.
One of the that will be coming up in just a second, Tracy, has to do with finding businesses, I think. And since we're on that topic, maybe we can just answer it now. I was on a conference call earlier in the week, or a Zoom call, with the other health department directors in the state about finding businesses, and almost everyone that started out doing that has stopped, because they said it's just not made a difference. That you find a business and you can go and talk to them and they'll be in compliance for a few days, or you can find them and they'll be in compliance for a few days, but the compliance passes very quickly. And it creates so much community discord, so many people going and getting lawyers, so many complaints to the board members and the county judges that they end up falling apart. So, I'm not sure that finding is the solution. I think the solution is people paying attention and following the guidance, but I don't know that there's going to be a way to make that happen. So anyway, Tracy, I know you're wanting to push us on.
Okay, next question. Thank you, Sean. Okay, number 3. I'm a business that runs box fans each day when I'm open to the public. Will this put my workers or my customers at risk of contracting COVID-19?
Actually, you can eliminate, let me say this, you're not going to be able to eliminate the risk. But I believe by using box fans, we know that with the circulation of fresh air. Now, I'm talking about bringing that fresh air in, so windows, doors open, something where that fan then is circulating the air, that's a good thing. That's replacing that stale air with good, clean, fresh air, and that is a helpful thing. That's something that we know that outside that the risk is less, but there is a risk. Just because you're outside doesn't mean you can't catch COVID. I mean, you still need to social distance. You still need to wear your face mask. We've had multiple things that we've seen happen outside, and people still contract COVID. But yes, by bringing in and circulating that air with those fans, that's a good thing. But it doesn't preclude the use of a face covering. So still make sure that your people are wearing the face coverings.
Tracy, Al Gibson's asking a question. He said he submitted this earlier. We may have not received it. I think we did, and I think it's on our list, but we'll answer it now since he's posting it. So he's saying, why is the governor's reports about the deaths in Clinton County not aligning with their information? We've reported now a total of 4 deaths in Clinton County, and the state's data is not synced with ours. It's not at all uncommon for the state to be 2 or 3 or 4 days behind us. You know, we're local. We get as far as new cases, you know, as soon as we get the lab report, we're able to report those. Occasionally, very rarely, it'll be a case that ended up misassigned to the wrong county and they may end up transferred somewhere. But, you know, basically our data is very accurate to the day. Whereas the governor's office, they get reports from multiple places. They may get reports from labs or doctor's offices or the health department or whatever. And so they may get duplicate reports, and it takes them more time to clean up their data before they report it. Same thing with mortality. You know, we find out about death. We call each positive case pretty frequently, and so we can hear the information much sooner than the governor's office. Now, a lot of times we won't report a death until we get an official notice, but we will know to be asking for that information or seeking it out much quicker than the governor's office would get that. So it's not at all surprising that they would be 2 or 3 or 4 days behind. You know, we're experiencing an extremely large surge right now statewide, and they have a limited number of people working up there too. And I don't know how many days behind they are and what else is going on, but it doesn't surprise me that they've gotten a little behind. So I hope that answers your question. So press on, Tracy.
Okay. Is the COVID oral rinse that I have been hearing about a good testing option? And will we ever have this option for testing in this area? How reliable is it, Dr. Wayman?
So the oral DNA company has received approval for using an oral swish sample to do the PCR testing. The PCR testing is the same test. It's just the sample that comes in a different fashion. This should be as reliable as a throat swab. To my knowledge, we do not have it in our district. I know that researchers in Louisville are testing the method, and I'm sure it'll come down the pike at some point.
Okay, thank you, Dr. Wayman.
I think number 5 is the question that Al just asked, so we can skip it.
I'm going to go to number 7. What is the general expected rate of false positives and false negatives regarding the most common tests used for SARS-CoV-2?
It's approximately 5%, and the false positive and negative rates are dependent on the incidence or the prevalence of the disease in the community. So the lower the prevalence, it produces higher false positive results.
Yeah.
Complicated, but.
And Tracy, I might add that these questions that we're answering now came off of social media. I just want to say we get a lot of questions asked to us on our social media pages, and we can't come close to, well, we try to answer as many as we can, but you know, we're not always going to be able to answer every question that's posted on social media. I'm sorry, there's just a few of us to go around, and we just can't do that. But there was a series of questions posted that we're going to answer now, and we have answered these on social media I thought they were several pretty thoughtful questions, so we're trying to answer them here, and we posted them back on our Facebook account.
Okay, the next question is, why isn't this important? Why isn't this important and the value metrics widely known and discussed?
So, as far as all of the testing stuff, we've spoken about that at our public media updates. You know, we've spoken about it almost every week since we've been doing these things. So I'm not sure what is being meant. Why aren't these kinds of things discussed? Maybe they're talking about why isn't it discussed at the state level or nationally. I would say probably because you're getting in the weeds and it's so complicated that most people don't understand it, even if you explain it to them. Dr. Wayman here is an expert, and she does the research, and she could tell you. She might not be able to tell you off the top of her head every question you could possibly ask, but she could find you the answer in a few minutes, I'm very sure. So, but as far as we go, every time we've had any testing questions, we've put those on our media reports, and we've talked about them every week that we've been doing these. So maybe the question is, you know, it says, why aren't these things widely known? You know, I don't know, other than I would say it's a pretty complicated topic that you know, when you're presenting to the general public, you probably don't want to get down in the weeds that deep. That's probably more of a topic you'd talk about with labs and physicians and medical people, and less in a public forum. So that would be my thought.
Every test has a different percent, false positive, false negative, and there are countless tests out there. It's really hard to summarize them all.
And COVID-19 is still a new disease. You know, it's not been around for 10 or 15 or 20 years or 1 year or 2 years. You know, it's not, there's still a lot to learn about testing and a lot to learn about this disease. And they obviously don't have it fine-tuned to the level of a disease that's been with us longer. So it's just a difficult thing. It's a new disease. It's causing a lot of impact, and we don't know as much about it as we wish we did.
Okay, thank you all. Next question. How do you distinguish between a patient receiving a false positive test result versus someone that actually has SARS-CoV-2 but is presenting asymptomatically? Are there serious effects to tease through these two?
Yeah, and when the question is saying SARS-CoV-2, he's talking about COVID-19. By the way, just so you know, there's different names for it, but we're still talking about COVID-19 or the current coronavirus outbreak.
So unfortunately, we cannot distinguish between these two scenarios. The history helps us. So if the person is likely to have been exposed to a true case, he or she may be more likely to be a true positive. Some people test positive and are asymptomatic at the beginning of their illness, but develop symptoms a few days later. We have an approximate 16% asymptomatic rate. And we do have patients who are asymptomatic when they get their test, but then as we call them every day, we find out that a few days later, they're symptomatic. So the other thing is that the PCR testing labs can give us a number of the amplification cycles needed to reach a positive threshold. If we had this number, we may be able to determine more closely true positives and true negatives, but we do not receive this.
And if that's going over some of your heads out there, I understand. We're in the weeds, and a lot of it's going over my head, but you know, people in the medical profession understand what Dr. Wayman is talking about. Karen asked, did we say we weren't going to find businesses? What I'm saying is finding has proven not to be very effective. Now, we may still find businesses when we just feel like we're beating our heads against the wall and there's no other option, but we would prefer to educate, and we would prefer to warn, and we would prefer to encourage than trying to find our community partners. You know, it's just not the places that are trying to find the businesses. It's just not really working out.
And you know, we have no way to actually close a business that's not following the masking mandate. Let's just talk about that one. Let's just make it that one. We have no way to close these businesses. Doesn't matter if it's a food service place or a factory. We're not able to do that. If we are to fine, we're talking about a $25 fine or you know, $25 or $50. Well, a lot of places, they're just going to say, hey, whatever, here's your $25, go on. That we still, when you make a complaint, we do reach out to these businesses. We still do that. So when you reach out to us, it doesn't fall on deaf ears. We actually do reach out to these places. We have people who do that every day. So it's not that we're not following up on them. We do follow up on these places. Our enforcement is very limited of what we can do, and even that fining power that if we is so very limited again. Also, we want to make, like I talked about earlier, it needs to be a cultural shift. If you'll remember, you know, when I was a kid growing up, and you went in any store, I can remember going to the grocery store plain as day with my parents. And people in the grocery store, they walk around grocery shopping, smoking cigarettes, you know, and that was normal. But now there's been a cultural shift on that, and that's taboo now. And
Cultural shift took years to happen.
It took a long time to happen. And you know what? Maybe there comes a point when we don't have to wear masks. But maybe this is going to be part of our lives from now on out. But it will take that cultural shift to see that happen.
Well, COVID-19 will pass, you know, but this won't be the thing that's causing us to wear masks forever. It will pass. And hopefully there won't be another event that requires this in my lifetime or anytime soon. COVID-19 may not go completely away. I mean, it may be a disease that's still in circulation for many, many years to come, and it may be something you have to get a vaccination for each year. But hopefully we will at least get to the point where there's a good vaccination available. We've got some other options other than all this fussing and fighting over whether or not to social distance and wear a mask. So,
Wait for those days, Mr. Crabtree.
Well, I know, and you know that's our hope right now by sharing public health information about, you know, if we're having a death a day and 4 hospitalizations a day, is that not enough to inspire people to be more cautious? I would hope it is, but maybe it's not. You know, I guess this thing's going to get as bad as it gets, and we'll try to get through it the best we can.
Okay, next question is for you, Dr. Wayman, also. Why do the testing labs insist on exceeding the recommended number of amplifications or spins of the positive PCR test against the recommended upper limit set by the inventor of the PCR test? Other than an attempt to produce as many false positives as possible, what purpose would this serve? And why do you accept this practice and continue to hold the PCR test as adequate?
So the PCR test was designed and calibrated to be very sensitive, so as not to miss positives in symptomatic people. Using it for surveillance of asymptomatic people increases false positive rates. That's just how it is. Knowing the number of these amplification cycles required to give us a positive result approximates to the viral load. If we were able to have these values sent to us by the lab, we may be able to tether out false positives. But at this point in time, we do not receive these values.
Now, of all the tests we have available to us, this is still the best test, is it not?
The most sensitive test, yes.
Yeah.
Sometimes sensitivity has a back problem, which is false positives.
Yes. So, you know, it's the best we got at the time. What percent of the time would we say it's correct? I think.
Well, they say approximately 3 to 5% false positive rates. But once again, that's one of those things that if you have a high prevalence, you're more likely to be a true positive than a false positive. If you have a low prevalence, you're more likely to be a false positive than a true positive.
So out of everything you just said, most of which went over my head, the part I'm taking from that is this test is about 95% accurate.
There you go.
All right. So that's about the best we're going to get right now, folks. And if you want to know more about, how many amplification spins it takes to, read away, I'm probably not going to be reading that stuff myself. So,
and if you Google it, you will find a lot of information.
Okay, next question. A recent case in Nevada reported to show a man who tested positive had fully recovered, but then contracted or re-got COVID-19 48 days later. Sorry, 48 days later. There are now similar reports from Hong Kong, the Netherlands, and other places. If true, what does this have to say about the usefulness of antibody mechanism-based vaccines developed?
So yes, it is true that we have had several cases of repeat infections. In the cases that have been investigated, all the people had a slightly different strain, so the immune system did not recognize it as something that it's already been exposed to. We do know that antibody levels wane, but we also have a cellular immune response done by the T cells. This type of immune response has memory, and we hope that this will take care of repeated infections with the same strain. A vaccine may need to be given repeatedly, especially if the strain changes on us over time. Mutations are common in viruses. We see this with the flu, and we have to have an annual flu shot for this reason.
Now, there's a question on social media about, Karen asks, it seems like if you were ticketing people and people were having to pay fines, it would, kind of eventually force them to comply. Well, the example she was getting fines for not wearing a safety belt or having a brake light out. There is some differences, though. The driving laws have been in place for a long, long time, and you have to have a vehicle in working order to be able to stay on the road. And the public overwhelmingly supports the concept that you need a safe vehicle to be on the road. And if you had your license taken for driving a vehicle that wasn't safe, most people would say, well, yeah, you deserve to have your license taken away. Don't you got enough sense to get your car fixed? COVID-19, you don't have that overwhelming amount of community support right now. We're early with this disease. People are still fighting whether it's a right or to mask or unmask. And, we don't have arrest authority. I know you're asking about fining authority, but we don't have arrest authority. And would even if would the police arrest someone for not wearing a mask? Well, they would arrest you if you refuse to fix your car and tried to keep driving on the road. But I'm just saying there's not the same level of community support, and the laws and things aren't shaped out clearly enough right now to do some of the things that we're talking about. And in the places that's tried to do fining, the health boards and the local politicians have pretty well strong-armed the health departments into stopping doing it because it created such a flood of complaints and so on. So my point is, you just don't have the overwhelming support for some of this stuff to happen. And that may be not what you want to hear, but I'm just telling you the truth. In order to enforce law, you need most of the public support behind you. There's only a few police officers in a town. If everyone in town was against them, they couldn't withstand that rebellion. But most of the population is behind the police and what they're doing, and they're people are going to support what they're doing. This is a cause that it's very controversial, and you've got people that's for it and people that are against it. It's just a much more difficult thing to try to manage. So again, I apologize if that's not what you want to hear. It's just the reality that we're up against.
And I will say that, you know, again, like Sean said, the health department, we have to work through certain channels to make these things happen. And I don't want to call anybody out, but if those channels don't support this and do not support us and what we're doing, then we don't get very far at all. So I know it seems like a simple concept, go out there and give them a fine, but it's not as simple as what, I promise it's not as simple as what it seems. We have to work through certain channels. Those channels have to support us. Those channels don't necessarily always support us or agree. And to the point of eventually losing your right to drive, for example. But with this, we don't have any authority to shut down a business. So you never lose your right to do anything.
I mean, the Department of Labor could revoke someone's license to operate, but would that hold up in a court of law? I don't know.
So far,
it's not come to that point yet to be challenged, but I would be skeptical to think it would hold up.
So far, anytime, just for example, and I'm not throwing labor under the bus, but when we've worked with them, there has been some orders, closure orders out there, and that's been very difficult. Did anybody end up having to close? No. So this is all very difficult stuff when we're talking about this. It goes back when we're talking about public health stuff that we're used to, the law's been on the books for years, that's easy. I mean, if somebody's selling contaminated food, can I take care of that? I can take care of that easy. But
we have overwhelming support for most of what we do. I mean, everyone agrees you should be able to eat safe food when you go out. Everyone agrees that you shouldn't be dumping your sewage into streams that people are going to end up drinking out of. You know, everybody overwhelmingly supports that when you go to a hotel or a motel to spend the night, that it should be clean. I mean, these are things that have been on the books for a long time that have an overwhelming abundance of community support. COVID-19 does not. And that's just where we are. So again, you know, every one of us as individuals, we know individually what it takes. We know how to social distance, we know how to sanitize, we know how to wear a mask, and we wish everyone would do it, but if they don't, you have the power to reduce your own individual risks. We would certainly encourage you to do that.
Thank you all. Next question. Can you walk me through the specific legal rationale that allows you to call for the violation of our constitutional rights in order to enforce your approach to pandemic mitigation? Can you point me to any exceptions in the Constitution that allows violations of these inalienated rights, specifically any that mentions communicable diseases? How do you define inalienable rights? And can the Kentucky governor supersede the U.S. Constitution and require you to take this action? Wow.
There's a lot there. I'm not a constitutional expert. You know, there's a reason why at the federal level and the state level, governors have and presidents have the ability to issue executive orders. And if you think it through, you don't want to take that ability away. I mean, if there's someone is invading your country, you don't want to wait till Congress meets to decide whether or not you're going to defend yourself. There's times when you need executive orders. Whether or not this is one of those times, I guess the courts will sort that out. What about us? You know, the laws that regulate public health have been on the books for many, many years. Those laws are in compliance with the Kentucky State Constitution, and they're in compliance with the federal Constitution. If they were not, in the last, since 1960 and 1970, they would have been challenged and overturned as unconstitutional. But they have been consistently found time and time again to be inconsistent with the Constitution. So, you know, our public health work that we do is legitimized by Kentucky revised statutes or laws and Kentucky administrative regulations that have stood the test of time and court actions, and they've held up. So no, we're not violating anyone's constitutional rights. Now, maybe you think that the governor's mandates is too much. Well, if it is, the courts will work that out. That's why you have divided government. That's why you have checks and balances. You have the executive branch, the legislative branch, the judicial branch. They check and balance each other. When one exceeds their authority, the other one's supposed to put them in check. And if they're not exceeding their authority, they won't. This is the system working. The governor's done what he thinks is right. It's going to go to the courts. The courts make an interpretation of that against the Kentucky state constitution, and the federal constitution, whatever it is. So I don't know what else to say about that other than public health has been on the books as a legally acceptable thing since the 60s, 70s, and on, and it's withstand court challenges for years. So, and the courts are obviously balancing things against case law and constitutional law. So,
Thank you, Sean. How can we be in a pandemic when the national excess of deaths haven't exploded?
Have not exploded. Well, not all diseases result in high death rates. We have all kinds of, pandemics, which is a disease that becomes worldwide and that may not have very high death rates. Different diseases have different mortality rates. COVID-19 does have a significant death rate. We know in Lake Cumberland it has historically for our district since March, 1 in 50 people have passed away from it. On the world scale, we know that comparing it to flu, it's 2 to 3 times more deadly than the flu, and at the state level, it's several fold times more deadly than the flu. So COVID-19 is a deadly death. But as far as deaths is not the only measure of what makes something a pandemic. Now, Dr. Wayman,
In fact, death rate is not even considered in a pandemic. Pandemic is defined as an epidemic occurring worldwide or over very many countries or areas. So that's the definition. That's a pandemic. And this one is worldwide. So it is a pandemic. It doesn't matter how many people die.
Lots of diseases cause sickness without maybe causing a great deal of death.
They're still pandemics.
But they're still pandemics. So, again, sometimes I think it's just a misunderstanding of the way things are defined and so forth. But anyway, that's the answer.
Thank you. Next question. How have almost all incidents of the flu or pneumonia disappeared during this crisis? Be specific. Is there a precedence for this occurrence, and what would be the mechanism?
It's a little hard question to answer. I know this pandemic started in China earlier, but for Kentucky and for Lake Cumberland, for Lake Cumberland, it was March, and for Kentucky, it was maybe early March when we had our first cases. So we were at the tail end of the flu season then. I know as the flu season was tailing off, that when the economic shutdown happened and everybody was staying in, the flu dropped off like
Precipitous.
Door shutting, But that was because everybody was staying in place and there wasn't anybody much getting out doing much of anything. So obviously you could stop a lot of communicable disease if no one was going out doing anything. But it's difficult to answer your question because this hasn't at least overlapped in Kentucky, and what I'm more familiar with, it's not overlapped significantly with the flu season. Our current flu season is just starting, and there are flu cases that's starting to pop up in our district now, so it's starting to churn up. I would imagine that flu will be just as proficient, what's the word? It's going to be there this year, and it's going to spread just as much as usual, unless the precautions we're taking with COVID-19. The more people that's social distancing and masking, that'll help with the flu too. So there could be some impact. So Dr. Wayman, you're the expert.
Yes, I mean the strategies help to prevent the flu as COVID-19. So if we distance and mask, we will have less flu as well.
Let's see, a question, or Judge Craig down in Clinton County says, thank you guys for all you're doing for the long hours you're working, and you're very much appreciated for trying to keep us safe. Thank you, Judge. I'm not sure. Karen asked another question, but I'm sure I can make that. I'll reread it while you're asking the next question, Tracy.
Okay, next question. Without a cure or a vaccine, how did SARS-CoV-1 cease to be problematic? And why should we assume SARS-CoV-2 won't follow the same course?
I wrote on this, and again, Dr. Wayman is more of an expert than me, but every pandemic runs a unique course. It takes some much longer to become worldwide and some a much quicker time, but every pandemic runs its own course. They all have different rates of infection. Well, no, is this your answer, Dr. Wayman? I'm reading your answer.
Yours.
Oh, it's sounding too good to be mine. I thought this sounds like Dr. Wayman's answer. Mortality, and they have different levels of herd immunity. We won't know COVID-19's herd immunity, for example, until sometime after the conclusion of the pandemic. Dr. Wayman shared a very interesting article the other day that showed different diseases historically where their herd immunity was, and they're not all at the 65 to 70% population level. Some achieve a herd immunity sooner. Some it's a higher percentage of the population. It really depends on how many people on average each person that has it infects, and that's called an R value or R naught or whatever. It's the way to calculate it, but it depends on how many people on average every person infects will affect what the level of herd immunity was. And again, epidemiology is not my area of expertise. I've just been reading the articles that Dr. Wayman's been giving me. Does that sound about right? Sounds about right.
It's a different disease.
Every disease is different. So, look up some of these articles about the spreads of these different diseases, and you can read about that. Maybe we can post on our website that article you shared that showed the herd immunity for all these different diseases and things that would kind of you could read on your own and understand each disease runs its own course.
That would be good. Okay, next question. Why was the original course of flattening the curve abandoned, which was to be used to advise us regarding when we could loosen the lockdown approach?
This question I don't understand. The original, in the beginning, the flattening of the curve response was to lock everything down. That was the first thing that happened, not just in our area and state, but around most of the world. That was the strategy that almost every country used initially to flatten the curve. So, the first flattening of the curve was achieved by the economic lockdown. The lockdown was abandoned because, not because it wasn't good at controlling the spread of the disease, but because society couldn't live with that level of restrictions. Plus, we know, that there's a lot of other complications that come with everything being totally locked down. Drug use and suicides and those kinds of things. So society wasn't going to live with that level of restriction. We believe that it doesn't have to be lockdowns and things. We really believe if people would social distance, would wear their masks, would try to avoid crowds, would wash their hands regularly, would do these things that we've been recommended. We don't need any future economic shutdowns, but maybe this thing is going to blow up so big that we force the governor into the corner where he feels like he needs to do that again. And whether or not society would cooperate with that again without a total rebellion, I don't know. All I know is I really hate to see one person dying on average a day and 4 people going in the hospital. And I think if we'd wear our masks and social distance until the vaccine gets here, we could save lives and hospitalizations, sickness and misery. I'd like to see as little of that as possible until we get the vaccine. And the way we can achieve that, wear your mask, social distance, wash your hands, try to avoid crowds. I don't know what else to say. I mean, to me, it seems pretty simple, but Obviously, it's not that simple because we've got a whole world of people fighting about it every day, which I can't understand, but there we are.
Okay, thank you, Sean. Next question. Why do we attempt to quarantine the uninfected, which is effectively impossible, thinking groceries, utility workers, police, medical, etc., instead of the normal procedure of using quarantine for only those infected or the most vulnerable?
I answered this one too, and again, Dr. William, you're welcome to alter my answer. Lots of times, by the way, to the people who are listening, we'll get these lists of questions, and a lot of times I'll write up the first response just as a starting point, and let these.
We leave you
We let if they think I've done a good job, they leave it. Otherwise, they correct it. So maybe I've learned a little through the years. Dr. Williams tried for years to teach me up, so she's still working at it. I put it's very normal for us to isolate positive cases and to quarantine close contacts. That's something we've been doing for the 20 years I've worked here, and it's been a public health practice for decades and decades and decades. The problem is it's just not been done at this scale or for this length of time. Again, this is the first pandemic we've gone through since 1918. Most of the time when we're doing isolation and quarantine orders, it's got to do with like sexually transmitted diseases, tuberculosis, or foodborne outbreaks. Something that's much more defined, much more easy to contain, much more easy to find out who all was exposed and to get whatever care they need and to get them isolated and quarantined until their infection period has passed or whatever the situation is for the disease. Those are complicated enough, but they're certainly easy when compared to COVID-19. You know, this is a pandemic. We know we're not going to contain it. Obviously, by definition, a pandemic is not contained. It's a world, basically a mini country or a world event that is being spread largely through community spread, which means you don't know who you got it from. We can't track it back to a particular case. You just got it from somewhere in the community. And, you know, the purpose why we're still doing contact tracing is it's not to contain the disease. It's to make an effort along with public health messaging and encouraging people to mask and social distance. You know, we're trying to do it to slow the spread as much as we can up until we get a vaccine. You know, if there was no hope for a vaccine coming soon, you know, I'm not so sure the best strategy wouldn't be to just tell people, just get on with your lives, you know. And maybe, I know there's people that believe that is the best strategy. I truly believe that until there's a vaccine, we can save lives and save hospitalizations if we will wear a mask, social distance, try to avoid crowds. And, you know, that's what I'm trying to accomplish each day when I come to work. So, Dr. William, you want to add anything to that?
Well, I was just going to say that the word quarantine comes from the plague. And this was in the Middle Ages when plague was around in Italy, and exposed people were quarantined. They were locked up for 40 days. Quarantine comes from 40 to prevent the spread of the plague. And that's what quarantine is. We try to prevent someone who's been exposed, who is not yet symptomatic, but perhaps will be, from spreading it.
So I've reread Karen's question here, and I think what she's saying is it doesn't seem like we really have anyone to turn to keep us safe, you know, because we're saying there's a lot of limitations to what we can do as far as enforcement on businesses and stuff. And to Karen, I would say, well, I understand where you're coming from if you're saying where's the legal authority to make people do stuff. You know, there's not a lot of places to turn to right now. This hasn't been around long enough and probably won't be around long enough to get all those laws and stuff in place. What I can say is the things that we've been telling the public since March is what will keep you safe. If you want to keep yourself safe, avoid crowds. And safe is not the right word. There's nothing safe in a pandemic, but if you want to reduce your risk greatly, don't be around people any more than you have to. When you have to be out, get to where you're going and get back quick. Wash your hands often. Wear your mask. You know, try to keep your distance from people. That is the best way to keep yourself as risk-free as you can through this pandemic until there's a vaccine. So I wish there was a way to make everybody do what we wanted, but I'm sure there's a reason why God and the government didn't give us that authority. So,
Sean, on that last question too, to add to what you and Dr. Wayman said, it talks about the normal procedure of using quarantine, and that normal procedure is to quarantine uninfected people who are close contacts. That is the normal procedure. But it is true, as they go on to point out, the more widespread it becomes, the more impossible it becomes to be able to do those quarantines. We're not talking about contacts, our cases here. We're not talking about infected people. We're talking about people who are contacts of infected people. And normally for STDs and other type TB and other type things that we may do a quarantine, we would try to quarantine people who were exposed. However, they may not be infected at this point, but yet they've been exposed.
we've used isolation and quarantine at the public health department, not only in our district, but across the state and nation and across the world and civilizations, societies for many years. It's just, again, this is a pandemic. It's on a different scale. With doing isolation and quarantine, again, with STD, TB, foodborne outbreaks, we've got a much better chance of truly containing it. With a pandemic, containment's not the strategy. Mitigation's the strategy, slowing it. You want to reduce as much death and as much hospitalization as you can until there's a vaccine. And, society is only going to allow a certain level of restrictions. Nobody's going to live with everything being shut down all the time. Nobody can live with that. What level of restrictions can we live with? Well, wear your mask, social distance, wash your hands, those kinds of things. Seems to me we could live with those things until we get a vaccine.
The question also goes on and reads about quarantining the most vulnerable. So, and I think I understand that to say those people most at risk. So those people with these other things, these other comorbidities that would make them more susceptible. And that's just something you can't do. All we can do is educate people who are more vulnerable people. We can't lock up people who are our vulnerable population. We have a lot of people who are vulnerable population out there. So, but they need to be educated, and they need to they need to be on very heightened alert. The more vulnerable you are, the more heightened alert you should be on, the more steps you should be taking.
Karen said, thanks, we appreciate what you're doing. Well, thank you, Karen. I'm glad we were able to have the discussion. And Karen's a good example of someone that you can talk to without turning into a big blow up because we don't see everything exactly alike. There is a way to reach a common ground in our society, which seems in the world we live in, everybody wants to fuss and fight all the time over everything. But
And I know Tracy probably doesn't want me holding this up anymore. I'm going to say this really fast. The most vulnerable people among us, they are the very ones, we should all be wearing masks, but they are the very ones that shouldn't be trying to go get these medical exemptions against wearing face coverings. If you're vulnerable, if you have asthma or you have other diseases, why on earth do you want to go get a medical exemption to not wear a mask? That absolutely makes zero sense to me. I do not understand that. I don't understand that. So, sorry, Tracy, go ahead.
For those listening in, we're down to the last couple questions. So if you've got any, we're running long. So if you've got any last minute things you want to say in the chat, this would be the time as we're getting ready to wrap up.
And I think one of the last questions is, why are the most vulnerable communities presently, why do they have fewer cases of COVID than other communities that are more affluent?
Well, the example they gave was Africa, the homeless in the United States, the slums of India. I would say in those examples, that's because there's no good way to track that information. You're saying that they seem to have fewer cases. Where's the evidence they're having fewer cases? Just because there's fewer cases reported doesn't mean they have fewer cases. That just means they don't have in some of these poor third world countries, they don't have the mechanisms in place to be able to mount the kind of response to where they can truly attack it like the more, affluent countries can and be able to track it. And the same thing with the homeless populations and stuff. They're a notoriously difficult population to track anything on because you see them one day and you never see them again. So don't kid yourself into thinking that the poor countries are doing better than the wealthy countries. They're just not able to report them as effectively. Would you disagree with that, Dr. Wayne?
Exactly right.
All right.
And I think that's all the questions we have, Sean. But I think one positive note we need to share with the communities also is there are people that are not masking up, but there's a lot of people that I've seen recently that do mask up. And you made a very good point. If we don't feel comfortable individually going in a place where people are not wearing masks, then don't go in there. Go somewhere else.
We had two questions, but we already had answered the last question. So I haven't seen any more questions come in. Mandy did say that check India's numbers; they're going through the roof. So that's probably true. I think the Europe and is it Asia right now that are really increasing?
A lot of countries in Europe are spiking.
Yeah.
Much higher than they did in the first.
Yeah. So, but generally speaking, the European countries have been on more restrictions, as I understand it. Am I wrong with that?
Yes.
Yeah. So America, being the freedom-loving people with rights to do what we want, we've been really dealing with this a lot more. Had a lot more spread and hospitalizations and death. Now that some of the other European countries and so forth are starting to release some of the restrictions, they're facing the same kinds of things. I'm not sure which way is right to have handled it. I guess it depends on which side of the political argument you want to listen to. Was destroying an economy worth saving some lives? I can't answer those questions from a moral perspective. The European countries are closer to a vaccine by the time they're getting their spike than we were. So, that's one positive thing, I guess. But, every country has its own unique struggles with this thing. My only political comment, I wish at the local level, the state level, and the federal level, this wouldn't be painted as such a political issue. We've known for I don't know how many years about droplet-borne diseases and the ways to prevent them, and just doing simple things like keeping your distance, washing your hands. If you've got a face covering to wear it. That's not new information that just came up that's controversial. That's been generally accepted ways to deal with things for I don't know how many years. So I wish we could have just kept it simple, but we haven't. So here we are. Not many follow you online or seek out your education you're trying to get across. Well, our Facebook following, we have a very large Facebook following for our district. So, I don't know if there's any other government agencies or private agencies that has as much of a following as we do on social media, but you're probably right. I mean, there's not as many people following it as we like. I would say, Karen, though, another thought, I think people are just wore out with hearing about COVID-19, and even though information's available daily at the federal, at the state, and at the local level, people just burn out on hearing about it, and they just want to move on and for it to be over, and they're just tuned out. So I don't think it's a lack of available good information as much as it is people are just tuned out at this point. And I understand that to a degree. I'm done with it myself, but this is my job. I can't quit fooling with it until it's gone. So we're going to keep doing the best we can until then. These diseases should not be politicized. There's lots of things that shouldn't be politicized, but
Absolutely.
that's the beauty of politics, I guess. I think our governor, like you, trying to do the best they can. I won't comment. I mean, I think the governor's done some good things and done some things he could have done better. I think his heart's in the right place. Not everyone would agree with that, so I'm not going to try to argue the point. And I think that's it. So, Tracy, you have any wrap-up thoughts for us today? We'll be back in 2 weeks, right?
Thank you all for joining today. We will be back Wednesday, November the 4th. I do encourage you to go ahead and send questions in if you have those, and we will put those together and answer them on the 4th. Do you all have any final thoughts before we close out, Sean, Stewart, or Dr. Wayman?
Wash your hands, keep distance, wear your mask, try to avoid crowds. Let's try to save as many lives and prevent as many hospitalizations as we can until we get a vaccine. It's
True,
as simple as that.
Also, remember to get your flu shot.
Flu shots would be good. We're going into flu season. It would not be a good time to get flu and COVID-19. That would not be a happy day.
Thank you all. I appreciate you all. Have a good day.
Thank you all